Alright, so today we're going to be doing the health assessment video. I have my sister here who's going to help me. She's not very excited about it, but that's okay. And first off, I would walk into the room and I would introduce myself. I'm Emily. I'm going to be your nurse today. I have washed my hands. Today we're going to be doing a health assessment, which is basically going to look over from head to toe. I'm going to listen with my stethoscope at some points. I'm going to feel on you at some points. And then we'll just be about 20 or so minutes. Do you have any questions so far?
No.
Okay. And feel free to ask questions throughout the examination if you're wondering about something. And then we did take her vital signs beforehand. And her temperature is 98.5. Her respiration rate is 12. Blood pressure is 136/78. And then her heart rate is at 86. Do you have any pain today?
No.
Okay. So after that, I would want to assess her LOC. I would want to assess her LOC. Sorry about that. In a real examination, I would have my phone on silent. So I would start with some questions about to assess for her level of consciousness. So what is your name?
Sarah.
And your last name?
Oh, is that you?
And then what's your date of birth?
December 15th.
And the year?
Right?
Goodness. It's like pulling teeth with you. And then do you know where you are currently?
Yes. In my kitchen.
Okay. And then do you know what year it is?
2019.
Perfect. So she is alert and oriented. Took a little bit to get that out of her, but that's okay. And then her mood, she is a pleasant mood. She's happy, she's smiling, I guess she's entertained, so that's good. And then next I would be examining, I'd go into the actual examination part, so this is going to be like looking over her from head to toe. We start with the skull. So just on examination, just looking at the skull, it is normocephalic. Her hair is thick brown and it's evenly dispersed. She has it braided today. I know our mom did that for you. And then it's free of any debris. There's no excessive oiliness or dryness on her scalp. Her scalp skin color is uniform. It is a little bit lighter than the rest of her face, but that's because she has thick hair, and so the sunlight can't get to that part of her scalp. But the scalp skin is all uniform with the rest of the scalp. And then I'm going to feel on your head, and I want you to tell me if you're feeling any tenderness, okay? When I get off of this bench, I'm so much shorter. Okay, so I'm just going to feel you. Do you have any tenderness in these spots?
No.
So the hair is soft, there's no tenderness, no insects, no bugs, nothing present like that. So after we check that, I'm going to go ahead and I'm going to check the face and the neck. So as we can see, her eyes are in the upper third, her nose is midline, and her mouth is in the lower third. And then the eyes are symmetrical. I need to unplug my computer. It's going to trip me. So her eyes are symmetrical. She has eyelashes present and they're everted. Her brows are symmetrical with dark, coarse hair, and they are that's symmetrical. The nose is midline. There's no deviation there. I don't note any lesions. I'm looking at your face. She has slight pink undertones to her cheek areas, but that is symmetrical. It's nothing abnormal, just a little bit of a pink undertone to those spots. I think it's getting pinker now that I talked about it. The skin is all intact. Again, there's no lesions. I think that's about it for the skin assessment. Her neck is symmetrical. I don't see any obvious abnormalities, no scarring, anything like that. So I'm going to feel her carotid artery on her neck. I'm going to do it one at a time. Okay. And then I'm going to do this side. Okay. So it's equal on both sides. I'm going to give it a listen and see if I note any bruise. Because I'm normally not this popular. Of course, when I'm recording something, that's when my phone blows up. So I'm going to listen on one side at a time. Okay. There are no bruise present, which bruise can indicate the tightening or of the, I don't know the technical term of it. I think I used to, but now I forgot. But it's the tightening of those arteries. So now I'm going to go over the lymph nodes. And so I'm going to feel on you, okay? And then I'm going to see if there's any tenderness. If you feel like there's some pain in that area, please let me know. Okay?
Mm-hmm.
So first I'm going to do the preocular. Lift your head up just a little bit for me. And then the post. Any tenderness so far?
No.
Okay, making sure you can see me. And then the post. And then the occipital. And then we have the tonsillar. Lift your head up just a little bit more for me. And then it's the submandibular, submental, and then superficial, and then the sub, which are a little bit deeper. I'll do that one at a time. And then the one thing I did forget on the face was the sinuses. So I'm going to press on your face, tell me if there's any tenderness as well. So we have the maxillary, no, this is the frontal, I'm so sorry. Frontal, and then the maxillary. Any tenderness? Okay, sorry I didn't press up all on your face, but I washed my hands. So, after that, there's been no tenderness noted. I'm going to move on to the eyes and do a little bit more in-depth examination. So I don't know where my pen light went, so I'm going to use my phone real quick. Okay. So got my light. So I'm going to be testing Pearl. So it's the pupils equal reactive round to light and accommodation. So the sclera are white, and then the conjunctiva pink and moist. Okay, and then I'm going to dim the light real quick and then test how reactive her eyes are. Dark. Okay, so I'm going to do one eye at a time. Okay. The light's going back on. So her pupils reacted to the light. So now what I'm going to have you do, I'm going to have you turn just a little bit and face me. Not all the way. I still want you kind of facing the camera. That's perfect. So what I'm going to have you do is to test accommodation. I'm going to have her look at a part on my finger and then look past that. Okay, so look at my finger. Okay, now look past that at the wall. My finger again. And then back at the wall. Okay, so accommodation is there. So she good on that. And then I don't have an ophthalmoscope, but if I did to examine her eyes, it would help me to visualize the back of the eye, the fundus, and the veins in that portion. And this is good for detecting like certain eye diseases like glaucoma or retinal vascular disease. So that's how we would do that. So now we're going to move on, and you can turn back facing. You don't have to look right at me. That way the camera can see you. So after the eye examination, I'm going to examine her ear since I still have my light here. And I'm going to be using this light to kind of visualize, see if there's any earwax. I'm going to do this on both sides and see if there's anything else, obviously. So, alright, I'm going to go to the other side. Okay. So, she actually doesn't have any earwax present in Kid Clean Ears. There's no foreign bodies. We don't have a otoscope here, but if we did, I would use that. I'd pull the ear up and back, and it'd help me visualize the tympanic membrane, which is the eardrum. It's supposed to look gray and intact, so it can help me visualize and see if there was like a rupture in an eardrum. So then we're going to move on to the nose and the mouth, more in depth with the light. So again, the nose is midline. There's no deviation. She's never had any breaks. And then I'm going to examine each of the nares. Okay. And then, so each of the nares, they're free of debris. And then I'm going to have you hold one side of your nose and breathe in. And then after you do that, hold the other side. So we're going to test the patency of the nares. So you can just use one of your hands. Okay? Yep. Okay. All right. Did you have any problems breathing in? Any stuffiness? Okay. So the nares are patent. And then now we're going to check the mouth a little bit more in depth. So her lips are pink. They're uniform. There's no dryness, no excessive moisture, and then I'm going to have you turn just a little bit towards me, kind of like we did with the pen light. With the eyes using the pen light. And then I'm going to have her open her mouth, and I'm going to use the straw to examine her mouth. Okay, I'm not going to stick it very far back though, don't worry. So I'll have you open your mouth, okay, and look up a little bit for me. All right. Okay, and then lower your tongue for me. Say ah. Perfect. So okay, you can close your mouth for now. Her mouth is moist and pink. The tongue is present. It's pink. Can you lift up your tongue for me? Okay, so it's moist, and I can visualize the veins underneath her tongue. Her teeth are intact. They're white. Her gums are intact. They're pink. There's no swelling. I don't see any foreign bodies. Her uvula is midline. And when she said "ah," it did move midline. So let me check again. Hard and soft palate present. They're pink. And then her tonsils, I would rate one more time, like a +1. So. Oh, all right. You can turn back. Trying to think and make sure I didn't forget anything in your mouth, but I think we're good there. And then we're going to move on to the abdomen, thorax, listening to the lungs. Do you have any questions so far? Okay. Did I put that in your mouth?
No.
Okay. I just touched myself with it in my face, so I wanted to make sure. Okay, so I'm going to turn off my light real quick on my phone. So first, I'm not going to have her take off her shirt because I have to upload this to YouTube, and that way to submit it. So in an exam, though, I would be examining the skin, checking for lesions, checking for scarring, just checking the skin. It looks like, though, her skin is uniform. Sorry, I'm peeking down your shirt. Her skin is uniform. There is no scarring. There is no abnormalities noted. So once you kind of examine the skin, excuse me, on the front and the back for, again, the lesions, the assessment, if hair is evenly dispersed, the color, any lesions like that, then you would move on to the palpation part. So I'm just going to feel around on you. Tell me if there's any tenderness. Just laughing. She just definitely doesn't want to do this, but thank you for doing it. Okay. All right, and I'm going to check your skin turgor, which is just kind of like your hydration level and the elasticity of your skin. So I'm just going to kind of pinch under your clavicle, okay? Okay, so her turgor is good. There was no tinting, so her skin is resilient, and it was like less than even 1 second, less than 2 seconds. So then I'm going to look at her spine. It is midline. Let's see. And then I'm going to use my hands on her back here. Turn just a little bit towards that way. So I'm going to use my hands and I'm going to put it at the base of her spine. I'm just going to kind of, on both sides, I'm just going to pinch the skin and have her breathe out and see how far my fingers go to kind of measure chest expansion. Okay, breathe in and breathe out. Breathe in and breathe out. Breathe in, breathe out. Okay, so chest expansion, it was symmetrical on both sides. Say 99.
99.
Say 99 again.
99.
So I was measuring for the fremitus, the tactile fremitus, by having her say 99 and having my hands on her back. And then, since you already turned this way, I'm going to go ahead and listen to you. And I'm going to listen in 10 spots. I'm listening to see if I hear any adventitious sounds, if it's clear, how her lungs are sounding. Okay, so what I want you to do is I want you to breathe in and out. Go ahead and do it through your mouth, and then just let me know if you're feeling lightheaded or dizzy or anything, and we'll pause, okay? Okay, so go ahead, big deep breath in and out. Okay, so the breath sounds are clear bilaterally. I didn't note any adventitious tones. Okay, and then what I'll have you do is I'll have you face the camera a little bit more for me. I'm going to listen laterally on 2 sides, and then I'll do the front. Okay, I'm going to check the other side. Okay, and then I'll have you scoot over just a little bit. Okay, and then I'm going to listen to the front, just the same as I did in the back. 10 spots, listening for adventitious sounds, and yeah, so Sorry. Okay. So no adventitious breath sounds heard. Equal bilaterally, clear sounds. You're okay, not dizzy. Okay, so that's good. So then I will be listening, I believe, to the heart. I think that's the next step in the abdomen. Let me see. Front, back, went down. Yes, I believe. And then I did the skin assessment and everything. So yes, just making sure I'm on the right track. So I'll be listening to the heart sounds now for this part of the examination. So again, I'm not going to have her take off her shirt, but I would inspect from this side and I would try to see if there was any heaves, any movement there. I would palpate and see if I feel anything. And I would palpate for the apical pulse. Sorry. So then I'm going to go ahead. Sorry, let me untuck your shirt there. I'm going to listen now. I'm going to name off the spots that I'm listening to as I go. Am I on the... Let me see. This is your right side? Okay. Making sure. So first we have the aortic. And then we move over to the pulmonic. And then it's AP, and then Erb's point. And then tricuspid. And then the mitral. Sorry. Okay, so I didn't note any pulsations. I listened for S1, S2, no S3 noted. And then, let's see, and then I identified each of the points. And then I'm going to listen to the apical pulse for a minute. So I'm going to go ahead and put a timer on. And I'm going to let know what her heart rate is based off of this too. So I'm gonna make sure I have it on right. There we go. Okay, I'm gonna start my time. Okay. So for that, I got 84 beats per minute on the apical pulse. And so let me make sure I did turn that alarm off so it doesn't go anymore. Okay, so that is now off. So now I'm going to take a second real quick. I'm going to reposition the camera because I'm going to assess her abdomen. I'm just going to lower it a little bit because we're on a bench, so I'm going to use the bench for her to lay down on. So I'm just going to pause it. Okay. Sorry, I kind of cut it off with the angle that we're at. So I'm just going to kind of bend down here. So first I'm going to examine. I'm going to check. There we go. Patient privacy. I am going to assess, see if the skin is uniform. It looks uniform with the rest of her skin tone. I don't note any lesions. It looks like there's a little scratch on her stomach, probably from a cat. So, but it doesn't look infected or anything. It looks like it's kind of scabbed over, nothing abnormal. I'm checking for striae, hair evenly dispersed. And then for the next part, normally with the skin, you can check temperature too, but since with the this part of the stomach, you don't want to mess with anything by feeling first with the bowel sounds. So I'm going to listen, and then after that, when I'm palpating, I will assess the temperature. So I like this one just so this is handy. I'm going to listen to the bowel sounds. This is your right side. Okay. So I'm going to start with the right lower quadrant. And I'm listening for bowel sounds. They need to be about 5 to 30 bowel sounds within a minute. That is normal. Anything below 5 is going to be hypoactive. Anything more than 30 is going to be hyperactive. So all right. So in each of the quadrants, I heard about 5 to 6 vowel sounds. A little low, but within normal range. So have you had breakfast this morning? All right. So that looks good. Now I'm just going to palpate. I want you to tell me, my hands are cold, I'm sorry. I want you to tell me if there's any tenderness, if you have any pain, okay? Any tenderness?
No.
Any pain?
No.
Any tenderness or pain?
No.
Okay. So I don't note any masses. The skin is warm and dry and uniform. So that is good. And then for the organs in the quadrants, this is the right side, right? I always get mixed up if they're not the same way I am. So the right upper quadrant, that's going to have the liver and the gallbladder. And then the right lower, it's going to have the appendix. And then in the left upper, you're going to have the spleen and the stomach. And then in the left lower, it's going to be like the intestines. So, okay, you can sit up now, and I'll adjust the camera. There's a cat down here. Okay. All right. And then, well, I guess I have to do like your peripheral, so I could have had you keep laying down so to do the leg. It's fine. I'm going to check your arms and stuff first. We'll do that. So, I'm going to check her arms. The skin is dry, warm, hair evenly dispersed. Let me check that one. We don't have any lesions. She has a tattoo on the inside of her wrist here. It looks healed and dry. And then I'm going to check your pulses at the same time. Okay, those are equal bilaterally. And then I'm going to check here. Okay, equal bilaterally. Now I'm going to check and see her cap refill on both fingers. Getting them in the camera. Okay, so it's less than 3 seconds. And the nails, they're pink, clean, in uniform. And the nail is less than 160-degree angle. And then I'm going to have you lay down again. I'm sorry. I forgot that you had legs. Okay. So, then we're going to do the same thing but with the legs. So, the skin is warm and dry. Skin color, it's uniform. There's no lesions, no tattoos. She does have a scar on this knee. It looks healed though. This is from, how old were you?
4.
4. She fell in class and cut her knee up, and then you had to have stitches. But it's well healed. It's pink. There's you can see the slight scar tissue, that white tone underneath it. So then I'm going to, let me kind of move the thing here. There we go. There's a cat. It's okay. He's fine. Don't mess with him. So I'm just going to check the pulses on both sides. This is going to be the tibial pulses, and they are equal. I would say they're 2+, just normal. And then I'm going to do the Doralis pedis pulses on top, both feet. I can feel yours. Yours are pretty thin. So they're equal bilaterally. Again, I'd say +2. And I'm going to check both sides. You can't really see the other one because of the cat. But I'm checking both sides. Cat refill, less than 3 seconds. There's no edema noted. I don't feel any edema. Do you have any pain while I'm pressing on you?
No.
Okay. So, I believe that's all for the assessment. You can sit up. Do you have any questions or concerns?
No.
Okay. All right. Well, thank you.